So beginning with the first, it's important to note that as mankind as a whole has gotten farther and farther from nature, they've become more focused on the laboratory rather than how the body actually works in day-to-day life. They've poured research and money into developing ways to assist nature. That's their intention, but they've gotten so far away from fundamentals. In fact, much of the credit that we give to doctors and pharmaceutical medications and surgical procedures as cures is actually nothing more than fancy performances around what the body was already programmed to do itself. You may have noticed this on your own healing journey, that you are constantly looking for the next protocol, the next supplement, the next practitioner, the next specialty that you hoped would finally hold the answers to relief from your symptoms. And this desire to find ways to assist nature is evidence that we've become disconnected from it. We have been trained and programmed to seek cures outside ourselves, externally, in fads and other popular approaches. And in doing so, we have undermined trust in the miraculous design of our own bodies. So for this reason, I want to remind you of a few facts. If you're familiar with the Germanic healing knowledge perspective, you understand by now that most symptoms that we call disease, such as pain, fatigue, inflammation, diarrhea, skin rashes, etc., are actually signs of healing. They're a sign that at some point in time, our subconscious was triggered. It assumed there was a threat, and the brain sent a message to the corresponding organ to adapt itself to help us survive that threat. After the resolution of the conflict, the adaptation was no longer needed and the body went into repair mode. Suddenly, we had digestive symptoms, coughing, sneezing, fevers, inflammation, pain. And this is really the natural phenomenon of healing. These are purifying efforts of the body. Take, for example, wound healing. When I worked as a registered nurse in the clinical setting, I loved wound care. I asked to be assigned to the really tough cases because it was so satisfying to start with an open, gory sore in the body and slowly measure and observe its progress over the subsequent days and weeks. And so when there is a cut in the tissue, the blood coagulates at the site, combines with exudate to form that airtight scab, which you're probably familiar with if you've ever skinned your knees. The purpose of the scab is to protect the wound and to stay exactly as long as it's needed. Underneath the protective layer of the scab, blood is rushing to the injured tissue to feed it, repair it. Nerves and muscles in the surrounding areas are multiplying rapidly to close the severed edges, and none of this is haphazard or chaotic. It's happening exactly as designed. As a nurse, I would put fancy creams and bandages and even wound vacuums attached to the skin. All any of this stuff did was enhance what the body was already designed to do on its own. After a wound heals, the scab is no longer needed, so it's no longer clinging tightly to the skin surrounding the area. Nature gets rid of it, and it falls off by its own weight. What more evidence do we need to know that there's an intelligent design and inherent power in our bodies that takes care of healing without our conscious effort? The same is true if you've ever fractured a bone, or if you've gotten a deep sliver in the body, that the body adjusted to push the sliver out without your intervention. See, the body is always wanting to return to homeostasis. Pain, fatigue, inflammation, night sweats, skin eruptions are all just signs that the body is readjusting itself. The thing you've been learning up to this point, however, is that as long as the disruption or disturbance remains in our environment or our psyche that led to the adaptations and repair in the first place, as long as that remains, the body can never fully complete the healing cycles that we're talking about. The natural order of things demands that the root cause, must be removed first, and then it can finish its own healing cycle. If you have chronic symptoms, it means that the disturbing element, event, perception is chronic and still present as well. Hopefully, if you've come to this group, you've had a chance to work through those root causes, those tracks, those triggers, so that you can come here ready to begin and end that healing cycle for the final time.